Hi, I'm Dr. Richard Robles. I'm a board-certified chiropractic physician. I specialize in using functional metabolic and neurologic treatments to help people with chronic conditions get their life back. Today's presentation is going to be about your thyroid. We're going to talk about normal thyroid function, as well as 6 different pathways that cause abnormal thyroid symptoms. Only one of these pathways is actually helped by medication. By that I mean hormone replacement medication. The first thing I'd like to do is talk about how your thyroid works. We know that your thyroid runs your metabolism. It's located in your neck, and the signals to start the thyroid, or initiate the thyroid to release the hormones, start in your brain, up here. Now the brain has a part called the hypothalamus. The hypothalamus secretes a certain hormone called TRH. TRH then stimulates the pituitary, also located in the brain, and the pituitary gland secretes something called TSH. You may be familiar with TSH because that's one of the markers that your doctor will look at to see if you have hypo or hyperthyroid function. This TSH then stimulates a couple of enzymes, one of them called TPO, which releases iodine so that your thyroid can actually make thyroid hormones. Then your thyroid will produce 2 hormones, T4 and T3. Now, 93% of the thyroid's output is T4, and 7% of the thyroid's output is T3. Now, T3 is going to be the active metabolic portion, meaning that it's going to initiate your body to produce more energy. Okay, that's the goal of metabolism, to break food down, to turn it into energy. And when your thyroid's working properly, then your body makes just the right amount of these hormones so that it can start to tell your body to produce more energy. So, why does your thyroid make 93% of its output into T4, which needs to be turned into T3 to activate your metabolism? That's because all of the activity doesn't need to take place in your neck. All the other tissues in your body require stimulation to improve their metabolism to produce energy. So what happens is once your body makes this T4, it's moved out to the tissues. And it's actually bound to a protein, meaning that it's attached to something else, kind of like getting into a taxi cab, and then it's driven out to the different tissues in the body. Now, 60% of your T4 is going to be turned into T3 in your liver. Okay? 20% of your T4 is going to be turned into T3 in your intestines, and the remaining 20% of your T4 is going to be turned into something called reverse T3, which is a feedback mechanism to let the thyroid know that it's doing things correctly. So the goal here is to turn this T4 into T3, the active thyroid hormone, to have an effect on your metabolism to increase the energy in your body. Okay, when everything's working right in your body, this is what happens. Okay, when we're looking at finding out what's not going quite right with your body, one of the first markers that you're going to hear your doctor talk about is something called TSH, or thyroid stimulating hormone. That's secreted by the pituitary to have that influence on the thyroid that we spoke of earlier. Now, we look at the laboratory ranges. They're going to be between 0.35 and 5.5. If you're on greater than 5.5, then you're going to be hypothyroid. If you're less than 0.35, you're going to be considered hyperthyroid. Okay, in this office, we look at the labs a little bit differently. Although we do respect the pathological ranges, and we know that if somebody has over 5.5, they do typically tend to have a hypothyroid. We look at ideal thyroid function occurring between 1.8 and 3.0. That's where we know optimum metabolism occurs. Now, where do they get these lab ranges? Now, if you look at the way that the laboratory develops these ranges, is they take the highest 5% and the lowest 5% of all the people who've had their thyroid panels run, and then they say, okay, well, this 5% is going to be greater than 5.5, and we see that that's a great cutoff point to label people as hypothyroid. And on this side, if you're less than 5%, on this side, then you're going to see that you're going to be below 0.35. And that's one of the reasons why you'll see lab values vary from lab to lab. Okay? So when we look at this bell curve that describes the different types of thyroid patterns that you see in patients, you'll see that there's a bell that drops off sharply, and so you have the 5%, but that's after the bell's already dropped off. So when we're looking at our 1.8 to 3.0, we're really assessing the top of this bell curve, which is where optimum thyroid function occurs. Now, who typically goes to get their thyroid panels checked? Is it somebody who has symptoms or somebody who doesn't have symptoms? Think about that. It's typically people who have a problem and they go to their doctor and say, hey doc, I don't feel quite right. what can you do to help me out? And the doc says, well, why don't we check, given your symptoms, why don't we take a look at your TSH and possibly your T4 to see what's going on with your body? So when they do that, these people are the ones that go and get checked more often than healthy, normal functioning people. So these lab values in the high 5%, below 5%, these are based on people who have a problem who go to see their doctor to try and get their labs checked. So this is what we call the normal sick range, between 0.35 and 5.5. Normal healthy is between 1.8 and 3.0. So if you have a 1.0 TSH level, your doctor may say, hey, well, that's a normal level. We'll keep an eye on it to see how things go. In this office, we know that that's a sign of a certain type of dysfunction. Okay, that means that your body's not quite working the way that it should, and we can optimize that. Okay, when we start to get things working correctly, your body makes you feel well. The body always wants to make you feel well, and our job is to help you reach that potential. So this kind of illustrates a big difference in the way that we look at the thyroid panels in this office versus the traditional way that your doctor may be addressing your thyroid problem. Now, when we talk about 6 different pathways of thyroid function, the first one that we're going to go over here is hypothyroidism. The reason that we're going to focus heavily on hypothyroidism is that 95% of all patients with thyroid problems present with hypothyroid symptoms. 5% present with hyperthyroid symptoms. And a good majority of hyperthyroid symptoms have a condition that's actually autoimmune in nature, and we'll talk about that a bit later. As far as hypothyroidism, since it accounts for the largest percentage of patients who have thyroid dysfunction, we're going to focus mostly on that. Okay? When you get the diagnosis of hypothyroidism, that's going to be based typically on a TSH level, your thyroid stimulating hormone, and your doctor may look at your T4 to kind of help them determine what type of medication you need. The primary treatment for hypothyroidism is going to be a medication called levothyroxine or Synthroid. And Synthroid is one of the top 5 most commonly prescribed medications in the United States, and that just keeps growing because more and more people are having problems that look like thyroid problems, that are being treated like thyroid problems, that have other causes. Okay, so hypothyroidism, we know that medication is given for this condition, and it will help a certain number of people. So because only one of these 6 conditions can actually be helped by the medication, we know that the medicine has at best a 17% chance of being successful. Now, how do you know if your medication is successful for your body? Well, once you've been prescribed the medication and it's been adjusted to suit your body, it should not need to be readjusted. If it needs to be readjusted, typically that means that it's not a problem that's going to be solved by thyroid hormones. It may take away the symptoms, but that's not what's causing the problem. And we're going to talk about that in just a minute here, about how you can tell whether that's what's causing your problem or whether it's something else. Okay? Because most of the hypothyroid cases, about 90%, are caused by something called Hashimoto's thyroiditis, which is an autoimmune attack on the thyroid, meaning that your body's own immune system attacks the thyroid tissue. The success rate of medication is even lower than 17%. We actually find that it's somewhere between 9 to 12% of people who will be helped by medication. Now again, when you're helped by the medicine, skies are going to be blue, rainbows are going to be bright, things are going to be normal. You're going to feel all right, and you're not going to have a return of your symptoms. When the symptoms return, there's usually a secondary cause for it, and that's where we come in.